Your back has been hurting for months, not from an injury, not after lifting something heavy, just a constant ache that is there when you wake up, that gets worse after sitting, that never fully goes away no matter what you do. You have tried rest, you have tried stretching, you have tried painkillers. Things improve for a day or two, and then the pain comes back exactly where it was. Here's what most people in this situation do not know. There's a specific point at which back pain stops being a temporary problem and becomes a chronic one, and that transition happens silently, without any dramatic event, without any new injury. The biology of the pain changes, and the moment that happens, everything that worked before stops working. I'm going to show you the 5 specific symptoms that tell you your back pain has crossed that line, and exactly what to do differently when it has. Comment below, how long has your back been hurting? Weeks, months, or years? And if this is the kind of honest health information you have been looking for, hit subscribe. Every week I publish what your doctor does not have time to explain. Most people think of chronic back pain as simply back pain that has lasted a long time. That is not wrong, but it misses the most important part. Chronic pain is not just prolonged acute pain. It is a fundamentally different biological state. When you first develop pain, the nervous system sends signals to the brain as a warning. The tissue is damaged or irritated. The signal is accurate. But when that signal runs continuously for 3 to 6 months, something changes in the nervous system itself. The pain pathways become sensitized. The threshold for triggering a pain signal drops. Neurons that were firing in response to actual tissue damage start firing in response to normal movement, normal pressure, even light touch. Think of it like a car alarm that has been going off for so long that it starts triggering from the vibration of a bus passing the street. Originally, it was detecting a genuine threat. Now it fires at anything, and it cannot tell the difference anymore. The alarm is real. The sound is real. But the threat it is responding to is no longer what originally triggered it. This is called central sensitization, and it changes everything about how the pain needs to be treated. After 40, this transition happens faster than it did at 30. The nervous system sensitizes more readily, and the window between temporary pain and chronic pain is shorter than most people realize. The first symptom that tells you your back pain has become chronic. Rest does not help anymore. With acute pain, rest produces measurable relief. You lie down, the pressure comes off the affected structures, and within hours, you feel meaningfully better. With chronic pain, that relationship changes completely. You wake up after a full night of sleep, and the pain is the same as when you went to bed, sometimes worse. Getting up and moving around provides more relief than lying still. This happens because the pain is no longer primarily driven by tissue irritation. It is being amplified by a sensitized nervous system that does not switch off during rest. A 2020 study in the journal Pain found that failure of rest to provide relief was one of the strongest predictors of chronic back pain, with a 3-fold increased likelihood of chronification in patients who reported no significant relief from lying down. 3-fold. The second symptom is spreading pain. Pain that started in one location and has gradually moved to involve more of the back or has started radiating into the hips or buttocks without any new injury to explain the spread. Think of it like water staining on a ceiling. The original leak was in one spot, but water spreads through the structure and the stain appears elsewhere. Your pain map expanding is the nervous system's stain spreading, and following the stain will not find the source of the leak. The third symptom is pain in response to things that should not cause pain. Light touch that produces discomfort. Normal sitting that becomes unbearable after minutes. Gentle movement that triggers a disproportionate pain response. This is called allodynia, pain from stimuli that are not normally painful. And it is one of the most reliable signs that the nervous system has become the primary driver rather than the tissue. I had a patient, David, 52, an accountant from Chicago. 3 years of lower back pain that had started as a right-sided ache. By the time he came to me, the pain had spread to his entire lower back and both hips. He could not sit through a meal. He had stopped driving. 2 surgeons had recommended surgery. His MRI showed disc changes at L4 to L5, but his symptoms were completely out of proportion to what those changes typically produce. We assessed him for central sensitization. The picture was clear. His pain had stopped being a tissue problem and had become a nervous system problem. We did not treat his disc. We treated his nervous system. 12 weeks later, his pain had reduced by 70%. He was driving again. He canceled both surgical consultations. Same spine. Same MRI. Completely different approach. If any of this is starting to sound like your situation, hit the like button. It helps this video reach people who have been told surgery is the answer when the real problem is somewhere else entirely. The fourth symptom is back pain that consistently disrupts your sleep, not occasionally, but as a persistent pattern every night. Chronic pain directly disrupts deep sleep and REM sleep, the stages where physical and neurological recovery occur. And disrupted sleep lowers the pain threshold, making the nervous system more reactive the following day. The pain disturbs the sleep. The disturbed sleep amplifies the pain. Each day starts slightly worse than the last. A 2021 study in Nature Reviews Neuroscience found that adults with chronic back pain showed measurable changes in gray matter density in the prefrontal cortex. The brain had physically changed in response to the prolonged pain signal. The fifth symptom is the one that brings most people to this point. Standard treatment has stopped working. Anti-inflammatory medications that used to provide meaningful relief now barely touch it. Physiotherapy exercises that helped initially no longer produce the same effect. Cortisone injections worked the first time, less the second, and by the third, provided almost nothing. This progressive loss of treatment response happens because the treatment is still targeting the tissue while the driver of the pain has moved to the nervous system. You are treating the alarm, but the wiring is the problem. Stay with me, because the 3 changes I am about to show you are specifically designed for when the nervous system is the driver. 3 shifts in approach that work when back pain has become chronic. A 2011 meta-analysis in the Journal of Pain found that educating patients about the neuroscience of chronic pain produced significant reductions in pain scores, not as a side effect of treatment, but as a direct result of understanding. When the brain understands that the alarm is misfiring rather than detecting genuine ongoing damage, the threat response decreases. And when the threat response decreases, the pain signal decreases with it. Rest becomes avoidance. Avoidance teaches the nervous system that movement is dangerous. And every time you confirm that belief by avoiding movement, the sensitization deepens. Start with small, controlled movements that your nervous system can tolerate without triggering a pain response. Not exercise, movement, walking, gentle rotation, staying below the threshold that triggers the alarm. Then slowly expand that threshold week by week. A 2019 study in the European Journal of Pain found that progressive movement reintroduction reduced chronic back pain scores by an average of 48% over 10 weeks, significantly outperforming standard physiotherapy in patients with established central sensitization, 48%, from movement done correctly. Because the relationship between chronic pain and sleep is bidirectional, improving sleep quality directly reduces pain sensitivity the following day. Consistent sleep timing, no screens for 60 minutes before bed, cool room temperature. These are not optional lifestyle suggestions. They are direct interventions in your pain physiology. 5 symptoms. Rest that does not help. Pain that has spread. Pain from things that should not cause pain. Sleep disruption every night. And treatments that have stopped working. When you see these 5, the biology has changed. The nervous system is the driver now, and the target of treatment needs to change with it. Understand what is happening, keep moving progressively, fix your sleep. Start today. If you want to know the single most effective exercise for retraining the sensitized nervous system in chronic lower back pain, that video is right here.